So everyone here is in high school, and everyone here wants to be a doctor? Yeah. Okay. Well, I was talking to you on the way over here. How do you guys know that you want to be doctors? And the only reason I'm asking is because it's a good question to think about. And I'm hoping with my time here I can explain a little bit more why you maybe want to be a doctor, but also maybe why you might not want to be a doctor. But if you do want to be one, I'm not going to focus on why not to be one. I'm going to go over that quickly. But if you want to be one, I'm going to focus a little bit on how do you get there. Because I don't know about you, but when I was your age, when I was in high school, when I was just starting college, it seemed like medical school was this big brick wall in front of me that I didn't know how to get through. Does anyone else feel like that? It's like you know where you're at, and you know where you want to be in medical school, but there's this big brick wall in front of you, and you just don't know how to get through it. You don't know how you're going to pay for it, right? Because everyone says medical school is very expensive. You don't know how you're going to wait for 12 years before you get married and have a family and move on with your life, right? There's a lot of these things that you have to think about. So first of all, how do you decide you want to do medicine? How did you decide?
Me?
Sure.
Well, actually, it's just, my family's Catholic, so it's pretty religious, and they taught me like, oh, you can be an instrument of God and save lives, so that's a really good profession, and you get paid for it.
Exactly.
Yeah.
You get paid to do good, pretty much. You get paid. It's one of the few professions that's out there that you can still make a difference in people's lives, and you get paid quite well still. It's not as good as it used to be. It used to be a lot better. Okay, I don't know what it used to be because I've only been doing it. Guess how long I've been doing it? Did I tell you guys yet? How 3? Anyone else? 2? 4?
You finished your residency 3 years ago.
Yeah, so I've been doing it for 3 years. So I finished my residency for 3 years. And how did I choose medicine? Okay, I'll kind of explain my story. When I was in high school, I grew up in a real small town in Minnesota. My dad was a park ranger, and my mom just took care of me. I was pretty much the only child. And I was spoiled rotten, and she just took care of me. And the one thing my parents did that was nice, which I think probably many of your parents do, is they believed in me. They pretty much said, anything that you want to do, you can do, which was really nice. Because a lot of my other friends, their parents pretty much didn't even give them attention or didn't say they could do it. But my aunts and my uncles, they all believed in me. All of my aunts were nurses. And so the one thing that they've taught me from very young is to be nice to the nurses, right? When you're a doctor, you have to be real nice to the nurses. And my mom believed in me, but I didn't know what I wanted to do when I was your age. You know what? Actually, I did know what I wanted to do. You know what I wanted to do? I wanted to be a professional magician. I'm serious, because when I was in high school, I juggled and I did magic shows, and I wanted to be a professional magician. And I always tell all my patients, medicine was my backup plan, because I couldn't make it as a professional magician, so I had to become a doctor instead. But I can show you magic tricks afterwards. I didn't bring any magic tricks really, but I can show you some. I did it since from 8 years of age, no, from 10 till 18, so 8 years I did magic. When I was about 17, I didn't know what I wanted to do for college, because we all have to go to college if you want to get into medical school, but I didn't know what I wanted to study. So I was an exchange student when I was 17, and I lived for a year in Brazil. And while I was in Brazil, I had a wonderful experience. The experience actually that made me choose medicine. Because in Brazil and a lot of other Latin American, South American countries, and a lot of other countries besides the United States, they gave their children 3 options of careers in Brazil. They said you could be a dentist, you could be a doctor, or you could be a lawyer. And that was pretty much the 3 choices. And I took that to heart. And I said, well, you know, I'd like to do medicine. And when I moved back to the United States a year after, I started to study at a school. Now I'm going to get into this story about, well, how are you going to pay for medical school, right? Because you have to pay for college first, and then you have to pay for your 4 years of medical school. Question to you, what school should you go to for college? The most expensive school, the least expensive school, the school with the best name, a community college? What's the best way of doing it? The one you're most comfortable with? Yep. Anyone? You probably haven't thought about it too much. You're all juniors and seniors. Juniors and seniors, you guys get tons of junk mail if you haven't started getting it. Who's getting like tons of junk mail already from every single college around? So you're all getting junk mail. You're trying to figure out what college to go to. You have to go to what college feels the best for you. So the most important thing is to visit those colleges. Try not to listen to what your friends say, and try not to listen to what your friends do. Okay, because you're going to have to make a decision that's best for you, and that's really hard to say. It's really hard to do. Because what did I do when I got back from Minnesota? When I got back to Minnesota, my mom, okay, don't listen to your parents, right? But my mom, she said, you know, Don, I'd like you to go to a little private school about a half hour from home so you can come home and visit us. So I went to Gustavus Adolphus College. It's a real small college in Minnesota, and I went there for 1 semester. Okay, my college was 4 years. I went there for 1 semester. Do you know how much my loans were for that 1 semester? Any idea? $10,000 for 1 semester. It was a private liberal arts college, very expensive. After my first semester there, I then I moved to Chicago to continue on. And in Chicago, I did another 3.5 years of college. I did 3.5 years. I did 1.5 years at a community college, and I did another 2 years at a state school, a state college. Okay? I didn't come from parents that could pay my way. I had to pay my way. They helped a little bit with like my room and board type of things, but I pretty much had to pay or get grants. There's things called grants and scholarships. And for that other 3.5 years, do you know how much my loans were? $10,000. So just to point out that you have to choose carefully your undergrad. The reason I'm saying you have to choose carefully your undergrad is because medical school doesn't give you scholarships hardly, doesn't hardly give you grants, and it's usually about $20,000 to $30,000 a year of all the loans you'll get. So just to put it in perspective, medical school, you're going to be in debt about $150,000 after medical school, unless your parents can pay it. If you go to a private school for undergrad, you're probably going to be in debt about $80,000. A suggestion may be to go to community college, which is a lot less expensive, go to a state college, and then apply for medical school and go to an expensive medical school. Because now that I'm a doctor, does it matter why I went to undergrad? Does anyone care? Does anyone ask me? It doesn't matter anymore. But I was able to save a lot of money because I'm paying off my loans probably for the next 10 years. And that's why I wanted to share something practical with you, that if you can save money in your undergrad and still get a good degree from a good school, and you might want to know, well, what grade point average do you have to have? Right? It's not just getting in. It's not just going to a school and finishing up. You have to determine two things. How well do you want to do, and what major do you want to do? What grade point average do you guys think that I had? On a 4, you know what grade point average is? On a 4.0 scale, throughout my 4 years of college, what was my grade point average to get into medical school? 4.0? No. 3.8. It was 3.8. So 3.8 throughout the 4 years. How do you do that? You have to study a lot. You have to study a lot. It's not easy. If I knew in college what I knew after medical school, because medical school you have to study a lot more, but you have to have a good grade point average. It's not always a grade point average. What other things do they look at besides grades? MCAT, Medical College Admissions Test, very, very difficult. I took it twice, okay? You don't always have to just do it one time. You can do different trials. I did a little a course, it was called, that helped me study for it. Then I took the MCAT, and then I applied to medical school. So what else is important? What else do they look at for your application process? Experience, like volunteer experience. I play guitar. I'm involved in my church. I was involved in Boy Scouts. I spoke another language. I did these other things. You all have to kind of look at yourself and take stock of yourself. Well, what sets me apart? Why should they choose you to go to medical school? It's not just being intelligent anymore. It's very, very competitive. You have to kind of look what sets you apart. Do you speak another language? Have you volunteered somewhere? Have you done some type of experience abroad in another country? So after I got my grades, I had to choose a major when I was in undergrad. What's the easiest major to get into medical school with? Biology. Any other thoughts? No, it's not biology. That's why I'm asking. Any other thoughts? What's the best major to get into medical school with? It's anything, but certain majors they give more of a preference to, meaning, well, let me explain. If you're in a room full of medical students, let's say this is a room full of medical students, we have about 30 people here. Would you want to be sitting next or choosing 30 students that all had biology majors? It'd be kind of boring, wouldn't it? Would you want all white Caucasians? It'd be kind of boring. Would you want all males? Probably not. That's what I'm getting at. They look for a little bit of variety in medical school. They look for people that are from other countries. They look for people that speak other languages. They look for people that take different majors. The best major to get into medical school is art. Some of the second best majors to get into medical school: history, English, computer science, Spanish. Those will get you into medical school a lot better than biology, chemistry. And I know this is probably all, you guys are all confused. Has anyone ever told you this before? Probably not. This is all brand new. And you don't have to believe me, but ask your guidance counselor, and I'll explain a little bit why. When you go to medical school, they don't want everyone to be the same. They want everyone to be different. And a second point I would emphasize to you guys, or you girls, everyone here. What happens if you don't get into medical school? You have a backup plan. What happens if you studied biology just because you thought it would get you into medical school and you didn't get in? You don't have a backup plan. You're going to be a biology teacher, or you're going to have to get a master's, or you're going to have to get a PhD. First tip, choose a major you enjoy. 2 reasons for that. It's a backup plan to medicine, and you're going to do very good at it if you enjoy it. Don't you do better at what you enjoy? If you have a sport, or you have a class, or you have a teacher that you like, you inherently do better. If you do better, you're going to have a better GPA. See what I'm getting at? And it's also harder. It's also harder, and I'll explain why. Have you heard of the PreMed curriculum before? The PreMed? So PreMed are pretty much all the courses that are going to fall on the MCAT. All the courses: biology, chemistry, organic chemistry, physics, calculus. Those are all the PreMed courses right here on this hand. If you do a biology major, well, that's included in the PreMed curriculum. So is chemistry. So is the other ones. So to get a biology major with PreMed, it's not too many additional courses. I was a history major. History doesn't have anything to do with PreMed. So I had to take all the PreMed classes and get very good grades, and I had to take all the history classes and get very good grades. And just a point, just to explain something to you as well. Do you know why I did history? I liked history. I thought I would be a good teacher. I think it would be fun to teach. I really did history because I was a horrible writer. I sucked at writing. I was horrible. Okay? That's the reason I did it. And if you do something that you're horrible at, you get better. And so I chose a major that I would enjoy, but I was really bad at writing. And history, writing is a really big component on it, and I got better at it. Another tip for you guys, if you have any weaknesses, weak points in your application process to medical school, in yourself, when you look at yourself, are you bad at public speaking? Are you bad at writing? Are you bad at foreign languages or at grammar? Are you bad at the verbal section of the MCAT? I was bad at the verbal section of the MCAT. That part where you have to read and answer the questions, I was horrible at it. And so what I did is every night I took the book, those books you can buy, and I read a section of it, and I just practiced. And the best thing, if I could pass one word of wisdom, is whatever you're bad at, practice it and get good at it, because you'll have a lot more confidence doing it that way. So after that, you choose an area of medicine. So you chose your major, you got your GPA, you apply to medical school. How many medical schools do you usually apply to? 20. Yeah, 20. A lot of them. Every one, though, you have to pay money for, so it's not cheap. You apply to a lot of different medical schools, and hopefully you'll get some interviews, and then hopefully you'll start. When you start medical school, it's kind of like drinking out of a fire hydrant. It is. you imagine drinking your face in front of a fire hydrant and you get all wet? That's what it's like because there's so much information. And pretty much all you're doing, for a lack of a better term, is you're eating and vomiting. That's what you're doing. You're taking in the information and you're vomiting it out in the test. That's what you do pretty much every day for the first 2 years. It's all educational. It's all eating, taking it in, doing it. And then the fun part starts, which is the rotations. Your last 2 years are rotations. Okay? But the reason I'm here and they asked me to come here is because I chose a little bit different route. Okay? There's 2 areas, there's 2 specialties of surgery that you don't go to medical school for. Do you know what they are? There's 2 specialties that you come out as surgeons and you don't do regular MD medical school. One is a podiatrist, which I am, and another one is a dentist. So podiatry and dentistry are areas of medicine that you're guaranteed to be a surgeon with. You're guaranteed to do surgery. You choose it while you're still in college and you go to a separate school. It's called Podiatric Medical School. We take the first 2 years with medical school students because there was a regular MD school, medical school there. There was us, physical therapy, physician's assistant. We all study the first 2 years the same classes, but we specialize in our last 2 years. So the first 2 years, it's all the same classwork. The last 2 years, you learn about radiology, looking at x-rays. You learn about surgery, how to do sterile technique. And what was interesting to me about podiatry is that I did 4 years of podiatric medical school, and then a 3-year surgical residency, and I'm done. Do you know how long it takes to become an orthopedic surgeon? How many years of residency? It's about 7. It's about 7 years of residency to do orthopedic surgery. I did 3. Now, mind you, I don't do surgery all over the body. I do foot and ankle surgery. But it was a lot quicker path. To do brain surgery, how many years? Probably 8, 10, 12 years. And that gets me down to the other point of really deciding about medicine. You really have to put your life on hold a little bit. I'm 33. I'm just going to be getting married now. All my friends, 10 years ago, they got married. They got their house. A lot of them have a couple of kids. And I was studying. They said they had their first new car, and I said, I'm still studying. They said that they bought their first house, and I said I was still studying. And the biggest thing I want to pass on to you is that if you want to do medicine, you have to put your life on hold. And that's one of the bigger challenges for you. And I'm not trying to dissuade anyone. I just want to really tell you the realistic portions of medicine. Medical school is really hard. Podiatry school is hard. Dental school is hard. All of them are really, really hard. But when you get done, it's very, very good. It's very rewarding. A typical day as a podiatrist, a typical week, I usually do surgery one day out of the week. Like today, I had a surgery. The patient I had today, she had something called hammer toes. Do you know what they are? Hammer toes are your toes where they're curved down. She also had diabetes. And because of the diabetes, she couldn't feel the tips of her toes. And when she walked, she hit the tips of her toes. And if you hit a lot of the tips of the toes, what happens on the tips? Any ideas? You could get a fracture. What? Flatten, but what else? No feeling, constant hitting. What would happen to anyone? Girls, when you buy a new pair of shoes and they rub in the back, what happens? You get a blister. You can get a blister. We also call it an ulcer or a wound. And she was walking on the wound, and it didn't hurt her. And she developed infections. I had to give her antibiotics. And it healed up, but then she had the curved toes, and it came right back again, over and over and over again. So what I did is I took out the joints, and I straightened out the toes so that they wouldn't happen again. Very helpful procedure for someone that has diabetes and someone that has curved toes. And next, I think on Monday, I have 4 surgeries. I have 2 bunion surgeries that I'm doing to fixing a bunion. That's a bump on the inside of the big toe. Taking out a soft tissue mass, taking out a nerve. You take out a lot of, you fixing fractures. So one day a week I do surgery. The other 4 days a week I'm in the office treating patients. Per day, and as a podiatrist, I treat about 30 to 40 patients a day. It's a little too many in my opinion, because that equals out about a patient every 7.5 minutes. It's very, very busy. I have a lot of medical assistants that help me. And a lot of the things I treat daily are like diabetes, foot wounds, fractures, broken feet, a lot of sores, people with swelling problems, tendinitis like Achilles tendinitis, stress fractures, plantar fasciitis, things like that. Pretty much anything related to the foot and ankle. Okay, it's a fun profession, very, very busy. It gets stressful at times because I have one patient right now that has a foot infection. They have this disease called, have you heard of MRSA before? Methicillin-resistant Staph aureus. It's an infection that is very, very challenging to heal with antibiotics, and the person may lose their toe or even their foot. Hopefully just their foot, not their life. And I have patients that lose their legs, and that's hard on me because it keeps me up at night. So you have to be careful the area of medicine that you want to go into in terms of what type of lifestyle it is. Okay. Do you guys have any questions about podiatry, about getting into medical school? You just don't believe anything I said, it was all a big lie, and you've been, better? Any thoughts? Any questions? Go ahead.
Like, do you know, obviously you know, but the athlete's foot, why do athletes get that very often?
So
I do like a lot of sports, and I'm like almost every day with shoes like tennis, and I don't want to get that.
yeah, so
My brother did.
the question is athlete's foot, and I always joke, I have a lot of these old men that come into the office, and they're not athletes at all, and I have to tell them, I'm sorry you have athlete's foot. And he said, well, I feel good about myself, at least you're calling me an athlete, and he wasn't an athlete. Athlete's foot is caused by a fungus. A fungus. A fungus lives in a warm, moist environment. The warmest, moistest environment is your shoes, especially ones that are closed for a long period of time. They don't happen to every athlete, but what happens is the fungus is all around us, and it tends to happen in people that maybe share shoes or in public places where you can get it, or you don't clean or sterilize your shoes. Everyone doesn't get it, but if you do get it, there's a lot of over-the-counter athlete foot creams that can help it a lot. It's close relative. Another fungus that can happen that pretty much is very, very common, and I always joke with everyone, if you had athlete's foot on your face, would you get it cured? Would you seek a doctor out? Yeah, because everyone, what's that thing on your face? You got athlete's foot on your face. But people with their feet, oh, no one looks at it anyway. Another thing that people have all the time is they have thickened toenails. They get fungus in their toenails, and they say, oh, no one ever looks at it anyway, I don't need to get it treated. But that's something that we treat, and usually it's funny because the guys, they come in for something else.